Who are you and why you here?
I'm the area director for Westchester and Hudson Valley for the New York State Nurses Association. So we represent all the registered RN at St. Joseph, St. John's, the County of Westchester, Westchester Medical Center, and so on.
And you represent, but in which level? Legal, what do you do?
We are a labor union, so we represent nurses in a contract, in the contract that they have with the hospitals, negotiations, if they have any grievances. And we also advocate on behalf of the communities that we serve.
So you know exactly what's going on at every level inside the hospital when it comes to the nurses, correct?
And the delivery of care, correct.
With this crisis, what is going on? Are you satisfied with what you see? Because one thing is what we see in front and another thing is what's going on behind the scenes. What's going on behind the scenes, Marisol?
Well, recently, our union, the New York State Nurses Association, filed a suit against the New York State Department of Health for failing to protect our members in a time of crisis. What we've seen is that our hospitals were not prepared to handle the pandemic. The people that worked there, whether you were doing cleaning or you were a technician, they didn't have the correct PPEs to deal with this pandemic or the proper amount of nurses working at their facilities.
So this was not just in New York State. The entire nation was not prepared for this pandemic. This was something that none of us expected ever to happen, but it did happen. Should the hospitals and everything around be prepared for anything that could happen in our country, in our state? Or there is certain things that perhaps are out of the scope?
A lot of things are out of the scope, but one of the things that we saw throughout New York State is that the governor was going around getting for example, the Westchester Convention Center, getting Jacob Java Center and setting it up as a bed. Those things we could have prevented because just last year, if you remember, they announced the closing of Mount Vernon Hospital.
Correct.
Last year, St. Joseph Hospital closed down 36 beds. So we have closed in the last 15 years about more than 10 hospitals throughout New York State.
And what do you think should have been done differently, Marisol?
I don't think we should be in the business of closing down hospitals, especially in poor communities, because if Mount Vernon Hospital would have been open at that time, they could have transferred some of the patients from the Bronx, which is just across the street. They could have transferred some of the patients from New Rochelle, which is just also across the street. So we need to make sure that hospitals, especially in poor communities, are opened.
But the hospitals are businesses, Marisol, and it has to make business sense for them to be open. So go ahead.
Hospitals are not business because businesses don't get our taxpayers' money. Hospitals get funding through Medicaid, Medicare, correct? And if you take away everything from a hospital, you take away all the services, you make it impossible for people in the community to use a hospital. For example, you know South Yonkers, correct? There's no maternity at St. Joseph. It has a high immigrant population, undocumented. So a lot of the folks from St. Joseph that want to give birth, where do you think they go? They go to New York City to use the public hospital system.
What is the biggest problem in regards to this crisis? What is it that the nurses are not getting? I know the PPEs, a lot of stuff that we are donating to the nurses. Is everything okay now? Has it normalized? Do they have everything that they need, or they continue to lack in certain protection?
Look, we just got a photo this morning from one of our nurses at St. Joseph Hospital that they gave him a plastic gown, not one that is the one that the CDC says you should get, a plastic gown that is open in the back. The kind of equipment that you need for this, you need a cap, you need something to cover your shoes, and you need a proper gown so you don't get your clothes infected, because if you use that, if your gown is able to infect your clothes, you are going to be you are going to travel to another patient room and maybe get that patient infected also. There were nurses at St. Joseph that went to Walgreens and bought shower caps and plastic bag with their own money. This is America. This shouldn't be happening here.
And now everyone is saying thank you to our heroes, doctors, nurses, people that work in a hospital, because they're all, one way or the other, they are helping the people. Now, this is what we see. Do your nurses feel that they are heroes when it comes to their own executives taking care of them?
No, they have a saying, we are not heroes. We didn't choose to put our life on the line. If you treat somebody like a hero, you give them what they need to be able to work. Nurses, like police officers, you want to come out there, you want to do your job, but you want to go home to your family. And all they're asking is that they get the proper equipment. They don't want to be heroes. They want to go home. They want to go to work and do their job.
Now, Marisol, let me play devil's advocate for a second, okay? So people can understand, people can see it from both sides. Yes, we all want the nurses and the doctors to have all the protection that it's necessary in order to allow them to fulfill and do their jobs without taking the risk of getting infected themselves. We all want that. But there is no protections at this time. There is a lack. We were not prepared. So what can the hospital do? We are blaming them for not giving the stuff that you mentioned, but there is none. They are asking for donation from the public. Are you saying that we have those protections, but we are not purposely given to them?
There are some hospitals that are hoarding. There are some hospitals that are doing better than the other. So St. John's, for example, is just down the street. St. John's is giving them a mask every day so far. It's giving them cover for their shoes. And for those that are dealing with COVID-19 patients, they are getting a gown. So why is that not happening at St. Joseph when it's just a few minutes away?
Did you speak with Mrs. Spicer about this?
We don't deal with Mr. Spicer. We deal with the Dean and Margaret. We have spoken. The communication is not the best. We have asked them for weekly meetings, like St. John does with us. We have an open line of communication with other institutions in the area, so we can have a dialogue and they can tell us what they need, and we can maybe help them there's a lot of organizations calling us, donating stuff. So for example, if Bronx Lebanon in the Bronx tell me, Marisol, we need gowns, we go and ask for donations for gowns. But there has to be a line of communication to open in order for that to happen.
No communication between them and you. Why? If they care about the nurses, and if they care about the doctors, and we're all working to give those people, the nurses and the doctors, what they need, wouldn't be on the best interest of the hospital to have an open communication and say, okay, let's see what can we do to keep our heroes, because that's what they're saying. They are our
Exactly.
heroes. So why do you think there is such a friction?
I don't know. To be honest with you, from the other hospitals in the area, we get an email daily updating us of what is going on in the facilities, how many COVID patients, how many people were intubated, how many nurses are out that are asymptomatic, how many nurses have been infected. We don't get the same kind of response from them. I mean, it was interesting. They also have a facility in Harrison, psychiatric, is called St. Vincent, right? So we are on the phone the few times that we've been able to get management on the phone. On a Wednesday, we are having a conversation with them, asking them to keep the dialogue open with the union, that we want to work together. The next day, Thursday, we get a letter in the mail that they are laying off 7 nurses. And we ask ourselves, we were just on the phone with you yesterday. You could have told us this.
Laying off nurses?
Correct.
I seen somewhere that many hospitals are asking for the retired nurses to come back in because the amount of patients is so great that they cannot handle. And now you're saying that this is St. Joseph's, correct?
Correct, yes.
And St. Joseph's is thinking about laying off nurses. Did they lay off nurses?
7 nurses, they were per diem at their facility in Harrison, which is St. Vincent, but it's part of St. Joseph because it's the psychiatric arm of the facility.
So there is no confusion and misunderstanding. St. Joseph's Hospital organization has a lack of doctors and nurses. They are, in general, we don't have enough to handle the amount of patients that are coming in. And they are laying off nurses.
Correct.
I don't want later on somebody to say, well, that's not true, you misunderstood. I'm just trying to make it clear that that is exactly what you are saying.
Well, we have a letter from them that we can send to you.
Oh, please?
Yes, we can send you the letter.
Email it to us. So this hero thing that we're hearing, we go in front of the hospital, police, firemen, and population in general, applaud them for the great work and sacrifices that they are doing. And we on the outside are seeing them as heroes. But seems like, for what I hear from you, that the executives in the hospital are not seeing them as heroes, because we give heroes everything that we can as a token of gratitude for the sacrifice that they do.
Exactly. Our members don't want to be heroes. They want to do their job and they want to serve the community that they can.
They want to have the equipment that they need to do their jobs. But Marisol, again, I'm trying to get it. Why? What's the friction? Why wouldn't the executives of the hospital give everything that they can to the doctors and nurses so they can do the things that they need to do? Is this trying to save money? What is it? I think we are having a problem with the sound, Marisol.
Okay, can you hear me?
Yeah, I can hear you now.
Okay, fantastic. So back in 2012, if I'm not mistaken, St. Joseph Hospital had 500 and something beds, 2012, correct? Today, St. Joseph has 136 beds. So in about 10 years, the hospital has cut down and basically in half. Last year, if you remember, they closed their dialysis unit. They closed 31 beds. This information is public, it's in the Department of Health website. So you are serving a low-income community where they are building about 4,500 luxury apartments. So that's about an extra 10,000 people that are going to move into the city of Yonkers, correct?
Yes.
Why would you decrease the services of your facility? How can you expect the city to grow and provide for its population when a hospital is almost naked, it's almost empty? And that's a question that all of us need to ask.
Now, do you think that St. John's up the street on Broadway, gets the same treatment as St. Joseph's?
No, St. John's has maternity, they have labor and delivery. So if you want to have a baby and said, my baby is a native son of Yonkers, that's the only hospital they can go to right now. St. John's right now is taking care of all the birth at New Rochelle Hospital has been transferred to St. John's. We have daily communications with St. John's, with their director of labor relations. He's someone that has experience because he worked for the hospitals in the city. If you know, one day I would invite you to walk through the hallways of St. John's and walk through the hallways of St. Joseph, and it's a totally different feeling.
I'm open for that invitation anytime you like.
Mm-hmm.
You know, we have heard many things, and people in Yonkers, at least the people that the St. Joseph's, helps, are not happy with the services that they received at that hospital. We have heard so many negative things from doctors, personnel. They don't serve the community in Yonkers in a way that the community would like. And they all say, if I have to choose a hospital, would be St. John's over St. Joseph's. And we understand why.
Well, let me tell you, Russ, one of the nurses called us crying because a young lady went in through the emergency room. She was COVID-19 positive. She didn't speak English, was a Spanish speaker. They tried to get a translator, they couldn't. So the young lady waiting, no one told her what was going on, got up and was walking around the hallway. This is about 2 or 3 weeks ago. She's COVID positive, right? She's walking around because she's getting desperate because she's laying in this bed and nobody's telling her what she has. So when they see her walking around, all the nurses and the other medical healthcare workers come running and take her and put her in a room. Finally, they got somebody from housekeeping and to translate to her that she cannot be around other patients because she's COVID-19 positive. This is a city that has a population that is 36% Spanish, Latino. And you cannot find a translator? I'm sorry.
It's unbelievable. It's unbelievable that you serve minorities, meaning Blacks and Latino mostly, and you don't have a staff member that can translate what a Latino person needs to say. That's terrible.
Yes.
Now, I saw a post from you the other day, Marisol, about this $1.4 million. Tell us a little bit about that.
Well, one of the things we have been doing is looking at the salaries of hospitals CEO. As you know, that's public information. And St. Joseph Hospital is what they call a safety net hospital. Safety net means that you operate in a community that is below the poverty line and that have a high number of people that are on Medicaid, Medicare, or uninsured. So because you are a safety net, you get extra funding from the state of New York because the state understands that you have extra expensive that, let's say, Lawrence Hospital doesn't have. So the CEO of St. Joseph, we've been looking at salaries. Mind you, St. Joseph has, I believe, 136 bed. The CEO makes $1.4 million.
Wow.
The top executives of St. Joseph, I apologize. I can tell you right now, I can tell you in a minute. So, you have this executive at a hospital that is a safety net hospital making 1.4, that includes compensation, making this exuberant. So an equivalent to that, we have a hospital in the Bronx, right? North Central Bronx. It has, mind you, St. Joseph has 100 and something bed, correct? North Central Bronx has 236 bed, correct? They see 55,000 people a year visits in the emergency room. They have 1,100 labor. St. Joseph has 100 and something beds. I don't know how many people they see in the emergency room. They don't have any deliveries because remember, they closed that down years ago. The CEO makes 1.4. The senior VP makes 400 and something. The another senior VP makes 4 something. So they all make, oh my God. So they all make, with compensation and all. So the top echelon of the hospital, they make over $300,000.
$300,000?
Most of them make 400, 452. Mr. Spencer makes $1.4 million.
Mr. Spicer?
Spicer, correct, yes.
Makes how much? How much does he make?
$1,227,334.
Wow, huge salary, huh?
Yes, and this is all public information. So if they are doubting this is all information that is in the state website.
What about bonuses? Do they get bonuses?
Well, that includes his compensation and let me see. He gets $287,000 in compensation. That's why his salary is so big.
Well, now that we have this crisis and organizations, we talk about hospitals, so let's talk about hospitals, are hurting financially. What do you think about those people that received such a huge compensation out of kindness because they care? They care about the hospitals, they care about the community, they care about the doctors and the nurses, and they call them our heroes. So what about returning the bonus to compensate our heroes? Because if somebody should be compensated here, is the heroes, not the CEOs, not the executives of the hospital. What do you think about that?
Well, I just gave you the example of that hospital in the Bronx that is twice as big as St. Joseph. The executive director of that hospital, so the Spicer version of that hospital, makes $239,000. So she's running a much larger hospital than St. Joseph with more visits, labor and delivery, and she makes a third of his salary.
So what do you think is going on? Because St. Joseph's is a non-profit organization. Looks correct. Like somebody's making a huge profit, not the correct. Hospital, but...
Yes, exactly. Not the hospital. They claim their bankruptcy. I don't know if you know that, for example, the CEO of Mount Sinai in the city took a pay cut. There have been some CEOs that have taken a pay cut because of the situation. One of the things that if you remember last year, when they were closing down the dialysis unit, we reached out to all the elected officials in Yonkers, all the elected officials. Uh, at that time, at that time, Tasha was not in office, but we reached out to everybody and nobody paid attention. Everybody was like, yes, I give you a letter. I believe the city council president, Mike Cater, sent a letter, but nobody else paid attention. Christopher Johnson, nobody else. Well, now we are finding out that if you are COVID-19 positive, you could have heart issues and renal issues. So if a patient comes through the emergency room of St. Joseph's with renal problem, what do? You privatize dialysis. There's no more outpatient dialysis. I think the delivery of care is something that all the elected officials in Yonkers should pay attention to. You know, you always hear that Yonkers wants to become the third largest city. We want to beat Rochester, correct? Well, Rochester has one of the best schools, medical school in the country, the University of Rochester, with a robust engineering program. So we always wonder, you know, you building all these luxury apartments in South Yonkers, but in the meanwhile, you are stripping St. Joseph Hospital. You are leaving behind 4 walls. How are you bringing all these people into a community with one hospital? St. John's is not going to be able to sustain a population of 200,000 people. It's impossible.
Well, Marisol, maybe that's part of the design. I don't know, because on those luxury apartments, if somebody there needs medical assistance or medical help and needs to be transported to a hospital, I will bet you that that person would say, no, take me to St. John's, maybe take me to St. Lawrence in Bronxville.
Correct.
Okay, so the most people that would be affected by the reduction of services at St. Joseph's is the Latino and Black community. People that cannot afford those apartment buildings.
Exactly. But, you know, maybe part of gentrification and moving people out of their community is cutting down all the services that they need to survive.
But you see, go ahead.
When you take away somebody's public transportation, when you take away somebody's hospital where they get their care, you are forcing them to move away from that community in a way.
See, but the problem that you just described is a problem that we've seen at many levels. We've seen the city of Yonkers growing at unbelievable speed. You know, we don't need an expert. We just we just need to drive around Alexander Street and see all these new buildings, new houses being built. It's growing. But one thing that we don't see growing as quick is a police department, fire department, and those departments need to grow at the same speed as the population, because they are going to serve that people. And when a fire breaks, it's not like the person has an option to call a fire department from another city. It's Yonkers Fire Department that's going to go there, or if the police department. So there is certain things that should grow at the same speed as the population is growing in Yonkers. Now, in regards to the COVID-19, which is the reason why all this came up. Otherwise, this would be on the back burner and we wouldn't be talking about it.
Correct.
Now, the people that go to St. Joseph's, Marisol, is Blacks and Latinos, mostly, not all. And we are being affected the most by this terrible infection. Any recommendations that you have for the Latinos and Blacks to help them take care of themselves, take precaution?
Well, I think, people always want to make it seem like people are getting sick because they're being irresponsible, and that is totally wrong. Um,
I don't know about that, Marisol, because I see people hanging around on the streets, playing games, fighting on the street, so
yeah, there are people that are probably doing those things, but where I live, I see people hanging around too, and they're not Black or Latinos. So, I think, but there's also a big component. If you have a high undocumented population, they don't qualify for unemployment. They gotta go to work to eat. If you have a high Latino undocumented population, they don't get Medicaid. They gotta go to work. If they get sick, to be able to pay for a doctor, they have to pay their rent. They have to pay electricity. They have to pay medicine. They tell you, oh, you have a 3 months period that you don't have to pay. But remember, those 3 months, they add up. Of course, people can always take responsibility. But none of these announcements that are done by the mayor's office are in Spanish. Um, his Facebook Live are in English. If you look at Sean Patterson Howard in Mount Vernon, who has a smaller Latino population, she started in her Facebook page putting everything in English and Spanish.
well, that's a good thing. Perhaps Mayor Spano would take that suggestion, because look, I have spoken to Mayor Spano many, many, many times, and what I get it from him is that he cares about the Latino community. He cares about the Black community. He cares about the entire Yonkers. Is Mayor Spano perfect? No, he's not. Neither am I, neither are you. No one is perfect. Is there room for improvement? Always. There is always room for improvement. So perhaps your suggestion is a great one. Have a translation in Spanish so the Spanish community can know what's going on.
Well, I think, to be honest with you, I agree with you. I am, from my personal experience, um, we as an organization, as a union, have access to the mayor's office. They always been very responsive every time we had a need. But the mayor cannot do it by himself. He needs help. He needs help from our elected officials that are on the state level to bring money to the city of Yonkers. This is not about blaming it on Mayor Spano, because we know that he's doing the best he can. But we have other elected officials from the city. I have to congratulate Assemblyman Nader Sage. He was one of the first people that called for Yonkers to have a testing site before anybody did. And I congratulate him because that was a lot. But Mayor Spano needs help from the elected officials that are here in Yonkers, that are in Albany, and that have the capacity to deliver for the city of Yonkers.
I'm sorry, the sound seemed like to be problematic. Since we are talking about Mayor Spano, and let me just remind our audience that I believe at around 12 o'clock, there will be another update from the mayor, fire commissioner, and police commissioner, I believe, an update on the COVID-19. So it's important, okay, it's important. If, it's important to know what's going on. And if by any chance you don't have somebody, you don't speak English, but somebody in your household does, please bring that person to you, watch the broadcast, Mayor Spano's broadcast, and ask your family member to translate, because this is important. You need to take precautions and you need to know what's going on. Don't always depend on somebody else to translate for you. Make all the efforts that you can to get the information, because at the end of the day, this is not Mike Spano's lives that are at risk. It's not yours. It's yours, not nobody else, and everybody at the same time. So bring somebody. Now we need to conclude this interview, Marisol. Perhaps there is something that I didn't ask, because sometimes it's so many questions and you forget one or two. but might be something important that I forgot to mention, but you remember. Can you tell us? Can you say?
We just want the community, all the elected officials to be very vigilant. Um, this pandemic is not over yet, and we need to make sure that we are properly able to to serve our most neediest people in our community. We need to make sure that both of our hospitals have all the equipment they need. Bringing food and pizza is very nice, but what hospitals really need is financial support. And we need to have a conversation after all of this is over about the delivery of healthcare in Yonkers, especially in poor communities of color. The city has done a great job, especially in the schools, delivering meals to those that don't have it. My son is 7 years old. His teachers, the school staff has been more than amazing in sending us homework and sending us what we need. And that is, I think the mayor is doing a great job in that. But we are asking the other elected officials to step up to the plate, to work with the healthcare workers to make sure that St. Joseph Hospital stays open, that they stayed open. I want to congratulate, Chris Johnson and Legislator Alvarado. They help us work with the county to give us a listing of where these people are coming from. A lot of the other city council members have been very helpful. Mike Cater and Sinead went with us to deliver equipment to the St. Joseph, so we want to thank them for that. We have seen the mayor going out to St. John's and St. Joseph, and we want to thank everyone that has stepped up to the plate. But for those elected officials that represent South Yonkers, they need to step up to the plate and make sure that has been respect.
Now, maybe it's not just the elected officials, but also the executives of the hospitals. They need to step up to the plate as well by putting their money where their mouth is. Don't just call the nurse.
We need to put pressure on them because for the longest time, they have not been held accountable. We did a press conference and they were so upset that someone managed to challenge their authority. And as the year moves on, we as an association are committed to fighting for those people in Yonkers that need the care.
Now, let's just move to the next city right next door, Mount Vernon. How is Mount Vernon handling the crisis? How is the performance that, in regards to this from the mayor? I'm just talking about the crisis. The hospitals in Mount Vernon. Are you satisfied?
She's doing an amazing job. Before she was elected, she took on the fight to save Mount Vernon Hospital. She sat down with both our union, 1199, CSEA, and with the hospital and listened to both sides. Right now, the hospital, they have temporarily opened the hospital. And I want to give, credit to the Mount Vernon elected officials. They are fighting to keep that institution open. Mount Vernon is only 4 and something square mile, but they believe that it has over 100,000 people and with no hospital. And people in Mount Vernon have a high rate of pre-existing condition, diabetes, asthma, cholesterol.
Why would that be, Marisol? People of Mount Vernon have this. Why?
You have a lot of folks that historically, a huge African-American community, historically that has been poor, have had few access to health care. But you know what's the interesting thing, Ross? Montefiore is the parent company and or has an affiliation with Mount Vernon Hospital with St. Joseph and St. John's. And they use the statistics from these facilities to write grant and to get money from the state of New York. What we have to ask ourselves, when they use these numbers to get money, they don't come and invest the money back into these cities. They take the money to the main hospital in the Bronx.
Gotcha. Now, in closure, Marisol, anything that you want to say? I'm going to give you the last few minutes of this interview to you. Say whatever you think needs to be said.
I want to thank you for inviting us. I want to send a huge shout out to all the healthcare workers, the police departments, the firefighters that are out there working, that are essential workers. We want to ask community members, community leaders that want to work with us in our campaign to save St. Joseph Hospital to contact us, contact the Nurses Union. We want to do a big campaign with community leaders, with patients, with healthcare workers to save St. Joseph Hospital. And we are asking the community to join us.
Marisol, how would the community join you? How can they reach you? Do you have a number, an address, a phone number, an email?
They can reach us at 347-978-3783.
On that note, we're going to conclude this interview. You have anything else, Marisol, that you need to talk about?
Please, to all the community activists out there, elected officials, reach out to us. We want to make sure that the community of South Yonkers has the best care. Healthcare, we have noticed from this, is not a privilege, it's a human right. And we need to make sure that St. Joseph is delivering the best care to the people of South Yonkers.